there's a lot of air in here. So priming means just releasing some of the air so it doesn't go into his system. We want to release it and have it removed from the tubing. Okay, first thing we're gonna do is we're gonna take it out of the package. We're gonna look to make sure it's not expired. And they'll be open like this. So we wanna close all the clamps, roller clamps, slider clamps, anything that they consider a clamp. And then this one, we're gonna open this by closing it, because once you take it off the pump, it automatically closes on you. So now it's flat. You see how it's flat inside there? That's what we want. Okay, so it's closed now, and we're gonna go ahead and spike our bag and make sure that the spike goes directly like a 90-degree down, because if you go sideways, sometimes we can punch your holes. So we're gonna go in like a twisting method back and forth like this. I wanna see the spike here, so it's there. And my tubing is clamped, so I don't have any problems that I'm gonna accidentally release all my fluid. You want to make sure chamber is half full. So you're gonna squeeze it and then let go. Squeeze it one more time. That's pretty half full. All right, so now you're going to expel some of the air from here. And you're gonna start slow. Let's see how it works. There's a cap here. We want to release the cap. And I'm just gonna use my thumb over here, and we're gonna start rolling upward. Sometimes if they've been used for a while, they may be a little stubborn to start out. Let's see what happens. Because sometimes it has to do with the pressure in here also, so we don't have a lot of fluid in there. Let's see what happens. I may have to give it some help, but I didn't want you to see this because you're not going to do this in the testing room.
Are we not going to be priming during the testing?
Yeah, but I didn't want you to see my trick to have this to have this fluid move, because it's too slow. It should be a lot faster than this. But it's starting to pick up, but the pace is just too slow. It's because it's been used and it's been wrapped up. And so how many times do you remember using it? More than once? Twice, yeah. Okay, here it comes. Okay, now, I'm gonna close it just for a little bit. I'm gonna open it. Okay, there. About right there. You see how the drops are very steady? Okay, that's a good rate right there. So now I'm gonna take my eyes off of that, and I'm going down here now, and I'm gonna follow it. I'm gonna see that I can get rid of all this air that's trapped, because I see some more bubbles coming along here. All right, so I'm following this one right here, so hopefully there's no more behind here. Okay, so if it starts to slow down, I'll give it a little assistance, but it looks like it picked up the rate really well, so I'm just gonna let it go. And this one, some more bubbles coming this way where my fingers are here. Okay, we're almost there. Okay. All right, so I'm gonna go ahead and close it by roller down. Close it now. And now I can connect it to my patient. All right, so we're gonna connect now, and then we'll put this tubing inside the pump, and then we will start the fluid. Okay, Mr. Ocampo, we're almost there. All right, still a little bit more. I see some more, so I'm gonna go ahead and release it before I actually put him in there. Look now, that's better. All right, I have to wipe again. "15 seconds, okay? So just verbalize that that day. 15 seconds, cleaning for 15 seconds. Then you're going to attach. So you're gonna push in and give it a little twist. And then I'm gonna go ahead and put him in the pump. I'll put the tubing in the pump. Okay, so you can start up there or here. If you put up there, just stretch it a little bit. And then pull up just gently, and then this is slide right in there, in this pocket. Okay. Close the door. Like, put your thumb up here, give it a little assistance because these doors are becoming a little weaker, so you want to do that. To turn it on is 4 seconds, and then you're going to let go. Okay. And then let it do its checking. So do some checking here. So we're gonna say he's not a new patient. He's been here a few days. Yes, I'm gonna be working there today. Okay, so it's gonna let me go in. I'm gonna choose channel select. And we have 3 options. We're just gonna do basic because we're just learning how to use this pump. We're gonna go in here and I'm gonna highlight my rate. I think my rate was 125. And then I'm gonna put in my rate. And then I'm gonna highlight the volume to be infused. And normally this would be a 500 bag. Okay, right now it looks like we have about maybe 100. So it's probably gonna be more than that. It's gonna tell me that I'm exceeding the volume. So I'm gonna put a little bit more. Instead of that, I'm gonna put, I'll just put the whole total volume, okay? So on that day, you'll have a full bag. All right, so now I'm gonna go ahead and start it. We're gonna open it, and we're gonna start it. And we're gonna wait a few seconds to make sure that nothing is interfering, and he doesn't have a sliding. If it's sliding lock is closed, unclamp it. This is open, and this is dropping. So it's telling you the drops per hour that he's gonna be getting, and this is the volume he has. Okay, so it looks like it may be okay. It hasn't beeped or hasn't detected anything that's wrong with it. So we're gonna leave it like that for just a few minutes. Then we're gonna say that it's been an hour. It's time for me to start his antibiotic. So let me clean up my mess a little bit. And I don't have to do any more flushing. Let me say this, because you had it kept. Let me say that. Okay, so we'll say that we went into the med room, and we are going to select IV tubing, and it has to be secondary. It has to say secondary on here, otherwise it won't work, because this is a shorter tube for a purpose, because we're gonna piggyback this into that tubing. It will have a hanger. Please save your hanger because we're gonna need it. Okay, so now I'm gonna go with this one just for practice. We're gonna say that we have a bag here with Ansev, and Ansev is 1 gram in 50 mLs, and it's gonna go, I can give this Ansev every 6 hours according to the order. So right now we're gonna start the first dose. So every 6 hours we'll get a new bag, all right? So I'm gonna go ahead and open it, and then we're going to go ahead and prime it. But before that, I'm gonna make sure it's not expired. There's nothing floating in there. It's nice and clear, all right? And it's going to have a label here that's gonna say Ansev 1 gram. Every 6 hours, gonna have Mr. Ocampo's name up there. So I'm gonna go ahead and match it to my MAR. It's exactly the right information. All right, so now for me to spike, I'm gonna take my spike out, and I'm going to look at it, and I'm gonna close the clamp. Okay, it's already closed, but let's just open and say it was like this. So we're gonna close it. And I'm gonna take my cover off my spike, and I'm gonna go ahead and take my tip off here, and we're going to go ahead and connect. And we're gonna go back and forth, because I need to break, there's a little plastic here that I need to break while I'm inserting this tip in there, and you'll see the little tip right there, all right? Okay, now before I prime, I'm gonna go and get my bag ready. This bag here has to be lower. So we need to put this hanger on the big bag, not the small one, all right? It always goes on the primary tubing, your hook. So you're gonna attach your hook into that, and this is gonna be lower than that. And now I'm gonna go ahead and prime. We're gonna prime really super slow because I don't want to lose the drug. It's suggested that we only lose about 1 to 2 drops, but it looks like there's fluid in here and there's a lot of air because it's being used. It's gonna look like I'm gonna lose more because I have to get rid of that air, all right? So again, squeeze your chamber half full like that. And we're gonna go ahead and open it slowly. This has to be done really super slow, but remember there's air and fluid in here already, so it's gonna look like I'm gonna lose more because it has to travel out of there. There it goes, too fast. We want it a little bit slower than that. Come on, right there, that's better. Okay, so it can push all that out. When I'm here, when I see this last bubble that's coming along, then I'll stop it. I'll say that is the end of the old fluid that's been in here. So I'm ready to close it. I have my thumb on there, and I am just waiting for that last one to, I may have to give it a little bit of assistance up there. Just barely open up the fluid by giving it one more drop. I think I got it all. Okay, I'm gonna close it. Okay. That looks good. All right. So I'm gonna go ahead and take an alcohol swab from here, and we're gonna clean. Try not to touch this, because if you do, just clean it. Okay, just say I'm gonna clean this. I touched it, and then you're gonna clean this. So get 2 alcohol swabs. So bring as many as you can and put them on your table. You want the first port, the very first one, which is this one here on the primary, all right? Okay. It's not down there. I just saw somebody do that today. I said, nope, and they were doing this. They were bringing this forward like that. If you see that, it's not correct. You see how it doesn't look correct? It has to be up here. It has to be piggyback to the first port, not the second port. Okay, 15 seconds. You're going to attach and just go in there and then give it a little twist. That's it. Okay. I believe this pump has a library, which is going to make it easier for you. So go ahead and go to channel select. Yes, it has a library. So you're going to go to secondary and press. And then you're going to, I'm not sure why it does that, this pump. You're going to go to, I'm going to try to find ANSEF, right? I can go to my A's, and I can go up and down on here, try to find it, but I don't believe it comes under that name. I think it comes under, the trade name is, I believe, not generic name. It's gonna be cefazolin. So we're gonna find it now. Let's see, up and down. There it is. That's the other name for ANSEF. I'm gonna select it. And it's saying, how did your pharmacy prepare this? So I know that I have 1 gram. 1 gram equals 1,000 milligrams, and I know that it's in 50 mLs. So that's the one I'm gonna choose. We're gonna choose that one. And it says cefazolin, 1,000 milligrams in 50 mLs, yes or no. I'm gonna say yes. And then pharmacy fixed it like this for me. They prepared it like this. So I'm gonna go ahead and go to next. And then I forgot to do my calculations in the Metrum, but I know that the pump can help me. So I'm gonna go to duration, because on here, there's a little memo here, a little written information that says, it says run over 30 minutes. So I remember that, so I'm gonna highlight my duration, and I'm gonna put 30 minutes in here. Okay, there it is. It gave me my rate. My rate's gonna be 100. All right, so now I'm gonna go ahead and start it. There it is. So what it did, by me selecting the start button, it closes this off, and then it will open this one up. So this is the one that's dropping right now. okay? And you don't have to do anything to close it. I'm not sure why it keeps doing that. I think it, okay, why are you doing that? I don't know. Not sure why it does that. It's not supposed to allow this to drop at all. It's even. Because it's not open. So something was wrong. So now it's stopped, you see. So we want to troubleshoot something that doesn't look correct. And I'm surprised it didn't beep. It didn't make a sound on it, but it probably would have in the next couple of minutes. But we found it, and so we opened it. Okay, now it's open. Yeah, because when you start it, this is not supposed to drop at all. It should be shutting down, and only this is going to be dropping. And then when it's done, I don't have to go back and reverse this. It will open this up by itself automatically. That will shut down. It will sense the computer in here, hey, there's no more fluid coming from that bag. This is gonna open up, okay? And that would be your primary, and this would be your secondary. So on that day, you have to do both. So do this one first to the end, do it all, and then you go and get your antibiotic, and then your secondary tubing and your hanger, and then you do that, okay? Because if you start to get them ready both at the same time, you're going to probably forget what you're doing, and you're going to mess up. All right, so one, finish it all, and then start with the secondary.